I'm going to be going live in a few minutes with Bishara, and I'm so excited about this. I have been really admire her work and her focus on wellness. So we're going to be talking about how wellness and mental health and narcissistic abuse, all these topics related to abuse and wellness are connected to our mind and our body, to our health. So we're going to be kind of covering a whole wide topic from all the way from the impact of abuse on our mental state, and then we're going to also jump into how how narcissists use a mask to hide who they really are, and then connect it to, but they're not the only group that camouflages. There are other groups such as autistic people who also camouflage. So we're going to be discussing how does that look alike or different? What's the connection between those two? So we're going to jump into that topic as well. And then why are there so many toxic relationships? Are narcissists the only ones who have a toxic relationship? Are there other forms of toxicity? Why do we use it, use that terminology and all that? So that's another topic that we're going to be discussing. So I'm waiting for her to join me or ask me to join. I'm not for sure which way this is going to work, but so I'm kind of in this holdings place. So, but I'm excited to be hanging out with you guys today on Instagram. It's just you guys. I'm just with you today. So you have my full focus. And you notice, if those of you who've been joining me on Tuesdays, because I always go live on Tuesdays at 1 to 2 p.m. Central Time, Tuesdays and Thursdays, I got it in focus today. So actually you can see a clear picture of me and a better picture of me, and I can read your comments. So there for a while I've been struggling to sort of find a really good computer setup to be able to see all of you. So thank you so much for being here today. As I said, I'm about ready to go live with Dr. Bishara, and her and I are going to be talking about wellness related to our mental health and as well as our wellness. She's a physician, whereas I'm a psychologist, so we're going to be talking about this mind-body connection, which is so pivotal. For anybody who's been in an abusive relationship knows that what affects your mind, what happens to you psychologically, has profound impacts on you, on your physical self, on your wellness, your level of wellness. So we're going to be talking about that on both of those. So I'm watching for her. Which do I repost these lives? I will be saving this, and I will be posting it somewhere. I'm trying to figure out how to do that. Usually I do this off a TikTok, makes it easier. So but I'll try to sort out a way to do that. But nice to meet you, Gigi. I'm sorry, I was looking at your whole name and got it kind of confused. But and thank you guys for helping, wishing me a good day. It's a start of a week. Can you believe that we're coming down to the end of September? I'm shocked. I can't believe that October is this next weekend. It's just incredible to me. It's like, where did all of this go? One other way, if you guys want to see reposts of lives and stuff, are you aware that I have a podcast? It's called Breaking Free from Narcissistic Abuse. Today, I just dropped an episode on the 5 stages of love bombing. It sort of pulls apart why love bombing is so intoxicating. It's not just about people missing the red flags. It's way more complex than that. There's actually, it's pretty sophisticated. The strategies used to love bomb is very sophisticated. So that dropped today. It's called Breaking Free from Narcissistic Abuse. You can find it on Apple. It's on Spotify. It's on most places where podcasts are played. Even Amazon has it. So that's one way. And also I have a YouTube channel by Kerry McAvoy, PhD, same handle as you find here. There's longer content there. There's where I post my lives from TikTok in the fullness go there. So I moved them from here over to there. I don't know if I can do this with Instagram or not. That makes it a little harder, but so you're able to watch the whole thing in its entirety over there. But and thank you guys for that. I appreciate it. I love Instagram. Instagram's a really warm place. I love the way that we can build community here. It's really, really fantastic. Very, very hospitable. So I'm trying to check and make sure I don't miss her. Okay, I'll go live and I'll wait for you to join. Okay, so she's gone live. I need to find her. I'm not for sure how to do that. Okay. There you go. All right. We are talking to each other. Oh, there she is. Okay, so she should be joining me, and I'm so excited to have her come live with me. I've been worried I've been ruining her name. Oh, I should be able to save and post too, Sarah. You think so? There we are. It's so nice to see you this morning.
You too. Now, are we live? Okay, so if you want to do it this way, that's fine.
Is that okay?
Yeah.
Yeah, all right. Because I went live and I started talking to people about what we're going to be talking about today.
You know what? Yeah, I'm hoping that my followers know to join as well. I think they should.
I think they should. I don't know how the metric works. It gets
Yeah.
Point is, but if you want me to, I can also let you invite me. So either way, I don't really care. Whatever works. No worries.
Okay.
I just know that I had to be live for you to find me, or you had to be live for me to find you. Yeah.
Okay. So maybe I'm wondering they should get a notification saying you're live for both of us. Yeah, I guess so. If we're both doing live, okay. I just wanted to make sure that those following me. But anyway, I'm going to save it and put it on.
Yeah.
So
great.
How are you?
I'm good. Thank you so much. Thank you for inviting me to do this with you. I really appreciate it. I'm excited.
I am too, and thank you for agreeing to do this. I've learned so much from you, from your Instagram, and I love your little tidbits of information, and it kind of excited me to get more information because I think so many people can learn from what you teach. So yeah, so let me introduce you because I know some of my followers aren't familiar with you. Dr. McAvoy, thank you for joining me. And Dr. McAvoy is a psychologist, and she's an expert in writing, but she's also an expert in cultivating relationships, both healthy and also recognizing unhealthy relationships, which so many of us have a hard time recognizing. So I'm really looking forward to speaking to you a little bit more about that. I know you're very busy, you write a lot, and you have a few programs that people can join in order to learn more from you. I know you have an Instagram and a YouTube, and we're going to talk a little bit more about that. But really looking forward to speaking with you, and thank you again for joining.
Oh, thank you. Thank you. Appreciate that.
Yeah. So, I first wanted to talk to you about the mental health crisis that we're kind of experiencing now, right? Where so many people post-COVID are really going through these mental health concerns that we are seeing just a rise of. And also to talk about how childhood trauma and childhood wounds really impact our adult relationships. And they're probably, and correct me if I'm wrong, they're probably the cause of most adult mental health conditions. And I'd love to talk to you a little bit more about that and kind of just get your feedback.
Yeah, thank you. It's been really tough to know what is the etiology or what is the source of problems for people. And there's all sorts of theories. There's the adverse childhood theory. There's also to what degree is it sort of a biosocial problem? In other words, biologically, we're hardwired with certain personality traits and deficits, and what impact does that have on us today? And then, of course, what we're going through, and COVID was a great example of something that was a highly stressful event that we've all survived together, which would have been classified as trauma. And you're probably seeing a lot of the post-traumatic response to surviving something so incredible, so intense. I know for me, I lived alone and worked alone, and so I did it alone, and even that was for me very life-changing experience to have gone days without seeing anybody at all except to talk to myself or what was on the television. So it's not surprising that that's happening. So what causes a lot of people's problems? And let's talk about for a moment personality disorders, because that's one of the big hot topics. Is we focus a lot about narcissism or antisocial personality disorder. Believe it or not, it's actually not. It's not childhood trauma that's the primary cause of it. It's been found to be primarily a biosocial problem. In other words, they're born this way. And then there's, in fact, the genetic twin studies rank it somewhere between mid-70s to 80% concordance rate between twins. But there's an activating event of some kind of a social activating event that helps set that in motion. So what is that? Well, we don't really know, except that it could be a mismatch between parent and child. It could be parental situation or home situation, but there's something happens that helps kind of cement this way of functioning to be in place. But you're right. The majority of us approach the world from a framework that we pretty much have been set by five. how safe we think the world is, how we anticipate each other responding, um, how we seek our needs, the way that we go out there, even the way we handle our emotions, how well we kind of control them or don't control them. A lot of those things we get in place and it sort of becomes rigidly set. Yes, we can make some adjustments. Therapy helps. Traumatic events actually are openings for us to do something different, but that kind of like sets the way we see the world, whether we realize it or not.
Yeah, that's really interesting. And I wanted to kind of touch upon a couple of things that you spoke about. One, the genetic predisposition to some of these personality disorders. And, you know, I know there's a genetic component, but do you know of any specific environmental components that also play a larger role? You know, there is that hypothesis of childhood trauma, but then there's also that sometimes it's not even trauma. It's just like this entitlement and just being in the world and kind of feeling like, you know, you're owed so much and you've been given everything. So have you seen that at all as well as a possible risk factor?
Yeah, well, they're actually when you look at a narcissistic's brain, same with antisocial personality disorder, when they look at the brain under neuroimaging, it's actually different. The areas that are over aroused and under aroused look different than an average typical person. And one of the areas that are over aroused is
Yeah.
mentation with self, this focus on self. So they have a very egocentric, everything is kind of evaluated against what it does for them, what it doesn't do for them, what they get, what they think is fair or not fair. More so, I mean, we all do that, but it's more so than the average person does. And then the other part of the brain that's under functioning is where they have a sense of pain or remorse or regret for what they do. So some of us have a really intense sense of shame or distress or guilt. And that part of their brain actually is under functioning. So they don't have the same kind of consequence that most of us have when we do something that we shouldn't. So here you put that combination together and you've got a bad mix. You have somebody who's like, what do I get? What do I deserve? And then when I do whatever they do and it doesn't have any consequences, then they don't see that as painful. And so, yeah, I don't know if there's I wish we could say this is an activating event.
Yeah.
Well, that's really, I mean, we all
Right.
know how hard that is to narrow down.
Yeah, and you mentioned parts of the brain, and you know, while you're saying that, I'm wondering, well, which came first, the chicken or the egg, right? Is that just an underdeveloped part of the brain, and then that's why they're the way they are, or is it because the way they are, they really didn't increase that, you know, neuronal activity in that part of the brain? Like I know there's like with people who have antisocial personality and narcissistic and borderlines, there's like that impulsivity, right? But there's also a lack of boundary recognition. So, and I've read, you know, like part of the frontal lobe, the executive functioning, like is, you know, it's not getting as much neuronal activity. So I'm curious, and you know, we don't know the answer to that.
We don't, and you're right, exactly, because we both know that environment does shape our brain, and that's the exciting part is that if you change what you do and how you do it, you affect yourself neurologically. It will have ramifications.
Yeah.
In fact, there's some forms of personality, or I'm sorry, some forms of mental health conditions that don't have good medicine to treat it, but yet you can. That's why therapy works, because the treatment changes the brain.
Yeah. Do you, what do you think about CBT in a lot of like personality disorders? Do you think it's effective or not so much? And I'm talking about the ones that are resistant to other forms of treatment.
Yeah, I actually got to hear Dr. Gregory Lester. I'm not for sure if you've ran across him, and he's a researcher who was involved with the DSM-5 on the personality disorder committee as they reassessed how it was organized for this latest version of the DSM-5. And he said that, and he works with personality disorders, that's his primary group. And he said it's actually it's rigorous work that helps people learn to compensate for their losses, deficits. He would say there's a personality hardwiring deficit, and then he helps them learn new ways of compensation.
Okay.
But it's, you know, a lot of the talk therapy or insight therapy, well, when you're lacking self-reflection and you don't have a lot of empathy, it's hard to address that. You have to have self-observation to do that, and they don't.
Yeah, no, definitely. Like lack of insight and lack of empathy is not a good combination.
No, he said it's deprivation. He uses painful deprivation as a motivation.
Interesting. Okay.
Yeah.
And you mentioned the adverse childhood experience study. Is that the study you were talking about? Yeah, the ACE study, which was a huge study. And you know, I kind of want to talk to you about the mental health aspects, which we've already kind of covered. But this study also kind of focused on the physical aspects of childhood trauma and how patients who did have these adverse childhood experiences, it actually affected their physical well-being too. And this is what I like to focus on in my wellness practice. I focus on gut health, but there's such a huge, mind-body connection and brain, connection that's involved in this. But people who had adverse childhood experiences, especially, and I think you mentioned this, under the age of 5, are more likely to die under the age of 65, more likely to develop heart disease, more likely to develop cancer. It's really important, I think, to recognize these, but I think there's something that we need to do as clinicians and train parents, early on before they, have children and say, these are the things that really can negatively impact a child.
Yeah.
But we're not doing that. And I think that's something that we really need to kind of focus on.
Yeah, no, it is. That's a really good point that you're making. There's a lot about how we need to learn to better self-regulate. And when you have a system that's been overwhelmed and flooded with all this hormonal response or fight or flight, and it's persistent, like it goes on, that has a lot of damaging effects. In fact, it's being found with narcissistic abuse in adults. The damaging effect actually changes the brain again, that the hippocampus is shrinking and the amygdala swells, and then there is a kind of a profuse poor functioning and executive functioning. So people who are abused, even as adults, that's why that mental fog and confusion they complain about, it's actually real. It's observable.
Yeah, it's like PTSD, right?
Mm-hmm.
Yeah. Really, really interesting. And, I wanted to talk to you about a little bit more about that because, the physical ailments, they've actually done studies, not only through the ACE study, but looking at the telomeres, which are the little, they're the caps of the DNA. It's kind of like the shoelace that keeps the shoelace, the cap on the shoelace. Well, telomeres actually help to keep the DNA strands from separating. And part of the aging process is our telomeres get shorter and shorter as we age. And they were finding that children exposed to trauma, they had shortened telomeres than other children compared to their age, and it's a process that continues. So hopefully there are more studies on that where we can find through therapy, but also through other factors that we can actually kind of reverse this or at least stall it.
Yeah, exactly.
Yeah, I wanted to kind of get your expertise on unhealthy relationships and kind of tactics used by people with personality disorders that abuse others without even realizing that they're doing it, right? A lot of this is like on a subconscious level, but terms like gaslighting, stonewalling, things like that are just very common tactics. Can you talk a little bit about the most common tactics that abusers use in these kind of toxic relationships, and also on trauma bonds too?
Yeah. Exactly. Yeah. And even do they know or do they not know? I think at some level they know it's not helpful because they're burning through relationships. That tells you something is wrong if you have.
Well, they know the other person is, not happy.
Yeah, exactly. Part of the problem with personality disorders is because it's part of the hard wiring. In their minds, they're themselves, so they're not a problem. But they have this whirlwind of chaos around them. So yes, you see all this disordered life. I think that's a good way to think of it, is the personality that creates all this disorder around them. But they then say you the problem, not that they're a problem. They don't have a problem. That you have a problem. But yeah, one of the things that they do is they've just, because of the losses, the deficits that they have, they don't take a whole lot of emotional responsibility for their well-being. And one of the things you'll notice right off the bat when you meet one is that they'll want you to be emotionally responsible. They'll set the tone to make you emotionally responsible. So one of the things they'll often do is they'll tell you a bad story about their life or how other people have hurt them. And there's a warning in there, or a code in there, and that is don't be like these people. So they're sort of setting up the parameter of the relationship, like this one never made me a priority, or this one I never felt safe with. They always ran me down, or they always nagged at me. But they're setting, when they do that, they're setting parameters around you. It's like, don't nag, and don't say too much. But so then they're also using love bombing tactics, which is they're kind of creating this really intense experience. Part of it is because back to this excessive mentation or excessive thinking about themselves, they've created fantasy what they think they deserve in life, and that they really want, and then they invite you into it almost as if a caricature, like you're casting for a part.
Mm.
And they fall in love with that idea. So there is, I believe that they are, in a way, it's more of an infatuation than actually a commitment. They can't
Yeah.
make that swing from
Mm.
infatuation to a commitment. But in their minds, they think that you really are going to be the one who solves all these issues and makes life good for them, kind of fixes everything that's wrong with them. And they invite you into that. And they lie to themselves first, which I think is super, super sad. And
Yeah.
but then you get pulled
Yeah.
into the lie.
I mean, I'm assuming you're speaking about romantic context. Like, does that happen kind of in the same way in familial context too?
Yeah, that's where the golden child is,
And
or yeah, exactly.
okay. Interesting. And then, people always talk about the mask, right? That, they have, and then the mask falls off. And I think masking occurs in so many conditions, right?
It does, yeah.
Yeah. So, and what you're saying is, that infatuation that one person feels, and they'll go back and forth. I just find it really, amazing that all of this, well, a lot of it is done in just an impulsive way and an unaware. You did mention that a lot of them are aware of the fact that their impact of their behavior has on another person. But I think in the moment, right? That,
Yeah,
yeah,
yeah. Well, again, if you're lacking self-reflection, it's
yeah,
very hard for you to say, this is not working out really well. What's going wrong with me?
yeah,
And then the person's being distressed and you're not empathic and care about that.
right,
And it even feels like a personal attack. It's a wound. Well,
yeah.
you're saying, I'm the problem. I'm not and then so all of this sort of, to me, it's like the perfect Rubik's Cube. It's all these same sides to a dynamic, but we see the different presentations, the way that impacts everybody.
Yeah, that makes sense. I've read recently about like the role of psychedelics in treatment of these resistant personality disorders, and because it kind of just increases their ability to like have insight and have like a world view that is not focused on them. Have you like had any experience with that, or like read any?
No, I think it's interesting. I'd
Yeah,
be curious, but
I
you know,
think some take it, as a, oh well, good opportunity for me to start using LSD. I mean, these are like what I've read. These studies are like they're one-time doses where it's very closely supervised. But yeah, let's talk a little bit about masking and how that looks in someone with a personality disorder or narcissistic personality. I know that you're an expert on that.
yeah. So masking really, back to this idea when they first meet you and they're in love with this idea of what they're hoping you're going to do for them, and they put their best foot forward. They want you to like them just as much as they're crazy about this idea. So then they present themselves like you. They then, and we all do it when we meet people on the first date. We kind of hide the harder parts of ourselves and we accentuate the parts that better. So it's not that they're doing something highly unusual, but they're doing it to an exaggerated rate. And they're to the point that there's a lack of honesty and integrity about what they're saying, because those things aren't really actually true. But yeah, a lot of people different mask. I mean, autistic people mask and other people mask as well. But if it's a different focus, it's the intentionality. And the intentionality with a narcissist or antisocial personality disorder is to have a relationship, not just to fit in. It's
Yeah.
to facilitate a connection with someone. And there are types of people in that group who are predatory, and it is deliberate. So you have all the way from those who are just doing it because they've fallen in love with the idea of they want a relationship and somehow you're going to be the one that fixes it, all the way to those who are predatory, thinking, I want a relationship with this person because they're going to make me look better, or they have assets in their life that I really want, or resources, or whatever. So it kind of ranges on the degree that it's from more of an innocent, kind of accidental, to very purposeful.
Yeah. And and you're telling me this, and it's so manipulative, but a lot of people don't even recognize the manipulation. And I think you had a video on your Instagram that which I thought was really really interesting, where it said kind of red flags to look for on a first date for someone that like stay away, like this is just a little bit worrisome, and maybe you can share those red flags with people.
Yeah. Yeah. So on a first date, you're going to see somebody who really shows up in a way that you've kind of unexpected. And they're going to tell you the shared history, and you're going to feel like, wow, you've never met someone so compatible. That
Hmm.
high level of compatibility is rare, especially the older that we get, the less likely that's going to be happen. So if you see that, not that that can't happen, but I would be cautious about why it's happening. And then they're going to tell you something super sensitive. They're going to shock you with something. It may be a great story, but more likely it's going to be a sad story or a difficult story. What they're trying to do is they're building fast rapport by seemingly sharing something vulnerable so that you then feel like you can drop your guard down and share something equally vulnerable, but also it makes them look sensitive. So you hear this and you think, oh, wow, they've been through it and they're sharing this with me. This is so emotionally mature. But so it's sort of setting the foundation for something. And then the other thing they'll do is they'll do what Gavin de Becker calls typecasting. And that's what I kind of referenced before, where they'll tell you things about other people or call you out for something and challenge you not to be like that, as a way to sort of begin to define how they want you to take emotional responsibility for the relationship. And then the other thing they'll do is they'll future fake, which is they'll kind of describe things that they hope to do with you in the future as a way to have you begin to dream about a connection with them that feels kind of long standing. So in a way, and then they tell you that they've never met anyone like you before, that you're super special and that you are one of the kind, and who doesn't want to hear that? But what it does is it sort of creates this bubble in a moment that you guys have this world together that's unique and just your own. So all of this creates a sense of shared storyline and history, which makes you feel like you've known them for a long time. And it makes you very suggestible and trusting and getting emotionally invested too fast.
Yeah. So it's like too much information on a first date, for example, or like too much vulnerability on a first date where you're like, I don't really know this person very well, right? But you're telling me this, and I know people that do that, like to get a friendship. I mean, this isn't just necessarily romantic, right? This is kind of their way to draw in people that they think, might be a good friend for whatever selfish reason.
Exactly.
Yeah. Okay.
I have seen it with friends. Friends do that. And I've also seen it with in-laws coming in. They'll do that too. Like, oh, I needed a mom like you. I've been longing to have sounds great.
Like several people that like the friendship started off weird, like they were, you just and again, like I focus on gut health and how the gut and the brain connect, and that gut feeling that they talk about, that's real, that gut feeling, and your gut's connecting with your brain. And animals have a really strong gut sense, and this is why they're a little cautious, because something tells them that there's something going on, and they don't have that skill where they can communicate, and children too are more in tune with their gut brain connection. So you'll see children will see someone that they're not as comfortable with as someone else, and you have to really trust them, and not force them to do something that they might not be comfortable with. And I know that happens a lot in families, like family reunions, where the kids are told, oh, give grandma or give auntie whatever a hug, or Uncle Joe a hug, and the child's like, I don't want to give them a hug, right? And we shouldn't stress that, because that child might be feeling something that you're not necessarily feeling.
Right. Yeah. And one of the parts that's really hard about the love bombing phase, and irregardless whether romantic or just in general, is that if you find yourself emotionally hungry and you feel like this person's going to somehow solve something for you, be cautious, because you should always place it in yourself. The solution is yourself, not a relationship. So and if it feels too good to be true, it probably is. So to me, that's the break system. If I feel like, ooh, wow, I really want this relationship, like, ooh, wait, you don't really know them that well. You haven't gone through conflict with them yet. You haven't seen them under stress. You don't know what they're like with other people. So so sometimes it's not always like, I was thinking back to my first date. Yeah, there was a few things that like, I don't really like that. But there are also some things like, oh, I really like that. But so both of them I should have been paying attention to. Not just the bad warnings, but also this is too good warnings.
Right. And a lot of times they'll bash every relationship that they've been in before. Oh, it wasn't me, it was the other person, and that person was toxic. So,
or they'll just say not enough, and you won't. That was in the case of mine. Mine was way overly simplistic. It was very shallow and kind of glib, and it lacked reflection of his contributions to it. I just didn't see a mature response of like, yeah, I really, I kind of blew it. She had a rough time around this and I just wasn't present. I didn't hear that. I just heard like, well, she did this and she did this. And
right. Well, and I'm glad you brought that up, because, a lot of a lot of mental health conditions kind of present in a way where, we know, right? Narcissists don't have any empathy, and they also they don't have the insight. But, and I know you are on the spectrum, right? You mentioned that
Mm-hmm.
you have autism, and so masking plays a role in that, right? Where you have empathy, but you might not necessarily be able to show it versus somebody who doesn't have empathy. So, can you talk a little bit about the masking that you felt you've had to do, kind of just to fit into this, neurotypical world? Uh,
Yeah, I've
everybody,
been doing it my whole life, so I don't even know what I would be like without it. I know when I'm worried that it's not going to work or I don't know all the rules. When you start adding more people in the mix, I get more nervous because I
mm,
can't quite figure it out as well. But yeah, so empathy is a problem for autistic people, and I don't know if it is for ADHD, but I do know that autistic people struggle. And
yeah,
interestingly enough, I don't always have a lot of emotional empathy, but I have a lot of cognitive empathy. So there's where I'm able to sort of, in fact, I've actually had clients say to me, I like the fact that you're so blank faced and non-reactive, but you really get what I'm going through. So they're telling me they feel that and they appreciate it because they feel it gives them space to be present. But
yeah.
it could come across as like I missed the boat, like I didn't really, I'm not, So if you tell me something really horrible, I'll like, oh, that's awful, but I may not
Yeah.
cry over it with you.
Well, it's interesting that you say that because I think like your type of brain is just like a more analytical type of brain, right? Where
Yeah.
it sees a different perspective versus somebody else who is described as neurotypical. And who are we to say that the neurotypical brain is the normal one? It's just probably more common, right?
Yeah, exactly. I've wondered that too. In fact, I think autism and I think people on the neurodivergent realm, we're adding kind of a mix to the
Right.
sample. Yeah,
Yeah.
different ways of thinking about things.
Yeah, exactly. And I think like a way to kind of differentiate, right? And you say you have cognitive empathy, but I think people who have artistic are able to show kind of their empathy in actions, right? Not necessarily with words, but more with actions. Whereas I think people with narcissistic personality disorder, they won't show it with actions as much. Like quite the opposite. They're very good with words, right? And like,
Right, right. Their behavior doesn't line up
yeah.
exactly. And interestingly, for me, I do better. I articulate things well, but I don't have as much emotional connection to what I articulate. But if I write it, I have a lot of emotional connection with what I write, which is why I love writing.
Interesting. Okay.
Mhm.
So tell me more, like share a little bit more about how you feel like you've been forced to mask from a younger age and how that kind of fits into who you are now. Would you like kind of looking back, would you have rather um, just not have to have that, like masking? Uh,
Yeah, I don't even know what, I mean, like I said, my father probably was autistic. I'm sure he is. All my sons are on the spectrum. So that's been kind of wonderful to sort of live in a family that's very similar to that. I felt
yeah.
bad for a husband who wasn't because he felt he was the outsider of the group. But so I'm not for sure how it would change, but huh?
He was a neurodivergent in your family. Yeah.
Yeah, exactly. Exactly. Yeah.
Yeah.
He used to say that the boys were my boys, and I kind of knew what he meant. Now I really know what he meant. He was saying you all get each other. I don't get you all.
Yeah. That's a,
But who would I be today if I wasn't masking? I don't know. I just know that in order to sort of fit into the world, it's good that you don't sit and constantly move, dance, and twirl and do all sorts of things that would
yeah.
feel good. Maybe I have my versions. If people sit with me and watch me long enough, they'll know that I do things with my hands a lot, or there's things that I am doing that sort of calm me down. But here's the part that I struggle with is it's hard for me to, believe it or not, I'm very analytical about things, but I don't always get the social rules. I
Hmm.
don't, especially when it's groups of women, it becomes very difficult for me to sort of understand. But then that makes me good as a psychologist because I've spent years watching and trying to figure this all out.
Yeah, no, absolutely. It's funny. Like I've read also, like they say the autistic brain is like an extreme male brain, right? Because for whatever reason, like people who have it, they're just like they don't get a lot of the intricacies that
Yeah.
when they get together. I don't know if you saw Queen's Gambit. Did you see
Yes,
that?
I did. Mm-hmm.
Yeah. So that they say that the character had autism. It's funny seeing her in the realm of like the girls and they're being very girly and she's like, I don't get this. I want to play chess.
That's how when I hear people talk about certain topics, like I don't, yeah, it just doesn't. you know, your aversion to it is such that I wouldn't even want that. That's the other part, is like, I wouldn't want to have those discussions. So I really don't care that I'm not a part of them.
But I mean, isn't that just kind of being someone who has preferences versus, you know, I like certain things that other females don't like, or vice versa. I mean, I don't know. It's just, I think society tries to place everyone in a little box, right? Women should
Yes.
act that way, children should act this way. Whereas, you know, kind of just let's be accepting of everyone, right? I mean, that's
Exactly.
yeah.
I agree. Yeah, I don't like how we label people. I don't even like labels. Honestly, I don't like labels. I
Yeah.
think too simplistic, too, I don't know.
Agree. Yeah. Yeah. So I know you wrote a book recently, right? And it's
Mhm.
uh, about a true story about, is it about your life
Yeah.
and relations that you kind of endured? Can you talk to us a little bit more about that? And I'm assuming your husband was a narcissist? Your ex?
My second husband was,
Yeah.
yes. Yeah. Yeah.
So yeah, tell us a little bit about that and how that dynamic, that
Sure.
trauma, well, talk about trauma bonds too. Yeah.
Yeah, exactly. So I was married twice. I was married for a very, very long time. I was married 31 years and lost him to duodenal cancer.
Hmm.
Quite suddenly. It was very catastrophic. And then when I was sort of in this life stage of empty nest, beginning looking at retirement, closing my practice, and then suddenly I'm losing my partner. I'm not married, and I'm losing all of that. And so I ended up in a second relationship pretty quickly and didn't realize I married the caricature of the worst aspects of my childhood. Everything that was unresolved that I had not worked on, I found in one person. But I met a narcissistic sociopath and married him. It was a con. I'm telling you, sort of the upshot of the book is that he set me up. It was a con, and my naivete, and there's where my autism played heavily against me. I tend to overshare.
Mm-hmm.
I have a hard time with understanding what's enough and not doing too much around all of that, and which is perfect.
Is that a typical autistic trait? Like, because I kind of both, like some
Yeah.
overshare and some undershare, right?
Yeah, exactly. No, oversharing is one of them. Especially if you talk to women, women will tell
Yeah.
you we overshare. If we
Okay.
just don't know. I mean, I just naturally do it. I just find myself
Yeah.
like reviewing things that I shouldn't reveal. And
Yeah.
yeah, it's very hard to realize that maybe that hasn't been earned yet. So this person took advantage of that in a massive way. And I ended up in a narcissistically abusive relationship. And interestingly enough, psychology hasn't recognized that until just recently. That's the new piece of the field, is that we focused on the individual and how the individual copes with relationships. And so when you come in with a problem, we assume that you're the part of the problem and we would work
Right.
with you. We don't
Yeah.
realize that your decompensation is a result of a relationship, and
Yeah.
that you were functioning well before the relationship. So I ended up in this relationship with somebody, and it was just awful, and very abusive, and I had a hard time leaving, and all the things that happen in a narcissistic abusive relationship, where they trap you
Mm.
not only with fear and intimidation, but they also usually find something, whether it's you buy a house, or you start a life, or you have kids, or you get a business. In my case, it was that we had a company in business, but they find a way to sort of mesh you with them and make it very, very difficult to leave and become very threatening.
Huh.
And yeah, it was intense. It's called Love You More: The Harrowing Tale of Lies, Sex Addiction, and Double Cross. I found out 2 months into the marriage that he had had a second life, a
Oh,
double life, and I had no idea that the person I had met really actually didn't exist. That I actually said that to him at one point. When
yeah.
down near the end of the relationship, I said, "This is what I thought life was like," and I described it. I said, "Is that anywhere near what life was really like?" He goes, "Not at all."
Crazy. You know, telling me this, and people are probably watching and thinking like, "Oh, that's not going to happen to me. Like, this isn't that common." But I know someone, Benita Alexander. She was a journalist who, I don't know if you've heard of her. She has a series called Love Cons, and
Mm.
had traveled to Italy to interview this famous doctor who was performing the surgery. He was an ENT doctor performing this throat surgery, and it's so interesting because her story is very similar to what you're saying right now. She got conned by him, and the lies that he told her. He was married, but I mean, he did everything. He did the love bombing, the future faking. He told her the Pope is going to marry us, and I mean, she got that, like entire brainwash thing, and then she didn't even realize that he was a con until I think it was a few weeks before the wedding, she was reading a news story about the Pope, and he was traveling to a certain area, and she's like, wait, he's supposed to be, marrying us. And now this doctor, believe it or not, the life-saving, treatment that he had created was actually not approved, and several people died from it. It's a really interesting story. I should get you two connected, because I think the two of you might be able to join forces. And so she has so many women that come to her and tell her, this, I had the similar situation. So it's not as uncommon as.
It's not. I've met a lot of people. There's a woman who's on Instagram and TikTok who's been gone viral. She lived with someone for 2 years, thought she knew him, and then he went missing, thought he died, started looking for him, and found out he had a whole nother name, whole nother life. None of it was real. I know.
Yeah. Wow. Ladies, if it sounds too good to be true, and men too, right? Yeah.
Probably is.
Right.
Yeah, exactly. Yeah, in fact, one of the things that's been painful about, and I should have known, my books, either they love it or they hate it. And the reason they either love it or they hate it is because they can't understand why I would have stayed, and what would have connected, what made me so long lasting. And what people don't understand, I think this is really something I want to make sure to emphasize, is that people who are toxic or predatory don't pick weak people. They're looking for two traits. And this was found in a large study with Sandra Brown out of 600 pathological love relationships in Purdue University in 2014. She found that there was two traits that tend to score high, and that is agreeableness and loyalty or conscientiousness. So they use your internal integrity, which is what, I was a person that made a commitment and stuck it out and saw things through and believed in the goodness of other people. And that's why such high functioning women get caught in these, is because we tend to work well as a team, but they're looking for that. And then they use this as a way to against you. They use this against you. Yeah. I was in the relationship for 2 years. I knew him for the total of 3. I found out 2 months in, and then I spent the next nearly a year trying to get help, thinking he said he wanted help, trying to get him help. And then, but by the second half, I'm doing 2 things in my head, and this is what happens with cognitive dissonance. So one of the things I'm about ready to release is online course on cognitive dissonance, as well as a workbook that's going to be sold wherever you buy, books. It's called First Steps to Leaving a Narcissist. But what happens with cognitive dissonance is that when you're living with somebody, even when it's not a con and it's not predatory, but it's still abusive, there's a dual reality, and they both coexist at the same time. You believe that you still have this good person, and everything they say about their goodness, and when they show up and give you whatever they give you is a way to keep you convinced that person exists. But then you're living with somebody else that feels like a monster. And both realities exist, and you can't decide which is true. And you live in this paralysis, this of indecisiveness, and that is the cognitive dissonance that's doing all this destruction. Yes, the trauma bond helps cement it. It's a sense of connection based on fear, reinforcement. So you're in this relationship that's fear-based, but you can't also decide what's real. And that, in fact, victims say, this is what Sandra Brown said, that the most agonizing part of the relationship is that inability to make a decision. And I would remember, I would fall into bed and try to think, what's real? What should I do? I don't know. Is he going to be better tomorrow? Maybe he really is getting help. Maybe this therapy point will make things better. And then you wake up and then you think, well, why did he just take all this money out? What is that going to go for? What's going to happen? I mean, you just live in this horrible place of indecisiveness. So, and what's so awful is there's no known treatment protocol for this yet.
No, I know. And cognitive dissonance is like, it's almost like your brain's really trying to protect you, right?
Yeah.
From negative influx. So it kind of goes back and forth, and it always seeks patterns and safety and certainty. So brain will actually try to kind of hold on to like a good memory, right?
Right.
And a lot of people in these trauma bonds is that they keep going back and forth, right?
Yeah, because you live in both realities at the same time. They're both true at the same time, and you can't decide which is the truth.
Yeah.
So you look for evidence to sort of like weigh it one. So I started doing really crazy things. I mean, I even one time followed him. I'm following him on foot across town, trying to find evidence that would prove that he really is a bad guy. Or, digging through stuff, counting medicine to find out, what he's up to that he shouldn't be up to. And all this stuff that you just look at yourself and saying, why? This is not me. I'm so out of control. But you're trying to make a decision, and it's very hard to break it. It's very hard, because part of what you have to face is that that what they do is the reality, not what they're saying. But what they're saying is so profoundly feels authentically real. It's
Right.
very hard to let go of that.
Yes.
But
Yeah.
yeah,
Which is a good point, like as a tip, if you're kind of confused and going back and forth about someone, focus on their actions and not what they say, right? Because they're
yes,
always going to tell you the truth. I mean, maybe early on they're, they're kind of on their best behavior, but eventually like as we say, the mask comes off and the actions, they can't kind of keep that up for longer than 3-4 months, I don't think, right?
maybe even up to a year, but it's exhausting. Yeah, they will keep it up for a while, but you'll see
Yeah.
you'll see moments of getting slips, and you'll see more and more profound moments.
Mm.
But then they'll started to become disillusioned with you, and you're gonna see more of it. And
Yeah.
then as they get ready to leave you, then it really comes off. It's interesting. So Hector brings up that codependent.
Yeah.
Codependent actually comes out of the addiction model. It's not part of a relational model. So it was first brought up. And if you look in psychological circles, we can't even clarify what codependency is. There isn't one definition out there. It's whatever decides to define it. But it's what happens in family relationships or in any relationship when you're trying to keep an addict safe. Mm-hmm. So the family or those that love them begin to intercede to try to keep the worst from their symptoms to affect them and from the family. So if they don't go to work, you call in for them, or you start hiding the alcohol or whatever it is they're using, hoping to stop the use of it. Yeah. It isn't really a way to describe people who get in. Maybe people pleasing, but to me, people pleasing is what happens when you grow up in a home that's been abusive or doesn't allow you to be yourself. You learn out of survival techniques to show up and keep people happy in order to keep yourself safe. Yeah. But it bugs me when people accuse
to other people,
victims of being codependent as if it's our fault. Yeah. The predator. In fact, Don Hennessy in his book, How He Gets Under Her Head, says these people who are predatory, who uses relationships to meet their needs with the exclusion of caring about what happens to the partner, get better over time. He says they become offenders, and he says they become more sophisticated than actually pedophiles are at this. And he says, don't ever think that you're that arrogant and that you haven't fallen for this. It isn't that you're that good with your boundaries, it's that you've not met that skilled enough offender.
That's fascinating.
Yeah. And he comes at it he's part of the Irish task force that works with domestic violence. And he said, spent years trying to find the common denominator among all victims and said he couldn't find one. There wasn't one.
That's so
we've been looking the wrong direction. We've failed to look at the predators who are doing this. There's the common denominator.
Fascinating. Interesting. So what other tactics do predators use kind of to lure someone in? Like, there's all these terms like people talk about, like stonewalling and gaslighting. Kind of talk.
Let's even talk. What's gaslighting?
Yeah.
Substitution of their reality for yours. So you come with an issue, something's going wrong, or you want something different. And then instead of focusing them on the issue that you're bringing, they're making you the problem for bringing the issue up. Mm. Or there's something's happening. Maybe you're calling it like, where were you last night? Well, you sleep really heavy. I don't know what I'm going to do about the fact that you just sleep super heavy and didn't hear me come in. And now you're on me about that? I don't, they'll make it about you instead of making it about whatever the conflict is.
And almost doubt what you're feeling is real, right?
Exactly.
Yeah.
Exactly. That makes you question that. Stonewalling is when someone just shuts down a conversation because they're uncomfortable. There's two types of people who do this. The first group is just emotionally overwhelmed. Mm-hmm. The situation, the arousal system is such that they can't cope, and they need to kind of cool off. Uh-huh. And a way to kind of solve that is to say, okay, so take 30 minutes, come back, and let's talk about it again. In other words, don't walk away and leave the conversation. But the second group is using it as a way to control the topic of the conversation. Mm-hmm. And so they're giving you a signal of, anytime you move into these areas, I'm not going to participate. And it then sets the tone going forward for the future, making some subjects no longer possible to be discussed. That's actually stonewalling.
Mm-hmm. Interesting. And I'm assuming a lot of these are done on a subconscious level again, right? Or do you
sometimes not. I mean, I think, again, it depends on the maliciousness of the person.
Yeah. You said your ex-husband had narcissistic personality disorder and he was antisocial?
Yeah, I believe he's both. Yeah. He's a sociopath versus a psychopath.
Yeah. I don't know if you've heard of HD Tutor. I've interviewed him a couple of times. He's also he has both, and it's fascinating to hear his perspective too, because he's actually one of the few ones that's aware. So
Hmm.
it gives all this insight on what they're doing and what they're feeling, and it's quite fascinating to just hear that. I guess like if we're kind of going to wrap up all this like in a nutshell is if the behavior of the other person is very confusing to you and you can't kind of figure out, right, like what is going on, and also they don't seem to be able to put themselves in your shoes, right, when they've hurt you, like that's a red flag right there.
Yeah.
And that's something that kind of just to look out for, especially if it's fine, we all hurt each other inadvertently and not realize it, but if it's like a repeated thing where they're constantly doing it and they just don't seem to like think twice about it, right?
Yeah, I would say if you see a pattern of, you feel chronically confused and you see a pattern of chaos, then
Yeah.
this is a person I would be very concerned about.
Yeah, I like that pattern of chaos in their lives. I think.
Yeah, exactly. In their lives, you'll see lot of job changes, a lot of relationship breaks.
Yeah.
They'll kind of complain about how people don't treat them well, or things are
Right.
unfair, don't work out right. All that you see that kind of, or you start to feel here's what I felt. I felt like, oh boy, here we go again. I always felt like I'm on like a roller coaster ride and we're about ready to take another dive on something. They'll do something like, let's start a new business. You're like, like, what do you know about new businesses? Or if you start to feel like you're vulnerable or unsafe, that's a sign to you that you don't have someone safe in your life. If you're feeling scared.
That impulsivity. Well, and that's a good point. And I've read that like that dopamine reward center in them is I wouldn't say faulty, but it's like they constantly need that like quick dopamine, right? That dopamine.
Mm-hmm.
And so once they have that dopamine surge and it's leveled off, it's like, okay, moving on to the next exciting, exciting relationship, exciting job prospect, whatever is exciting in their life.
Right. The way I've heard it described that I love is called a low receptive capacity.
Mm.
So if you think about whatever we do, it pours into us or it gives us something, like even this meeting our needs at some level. But if you're a person with a low receptive capacity, you'll walk away and this feels like a nothing. You'll need another thing and then another thing and then another. So they're using everything around them to sort of fill this chronic, empty, bored, restless something, this internal state that's always not. Whereas most of us, we get satisfaction out of the things that we do. We go to dinner with people, it feels good. We go home happy. They go home dissatisfied, empty. It didn't do it.
And they never feel fulfilled. And
Nope.
that's part of the problem is there's this constant need to like cycle one after the other of just from others, right? And meaning from others.
It's insatiable. It's like a black hole. More. I feel sorry for them, honestly. What a horrible life that would be.
Yeah. Well, and then coupled with just that just inability to self-soothe and I don't know, it's bad. Lack of insight and inability to self-soothe and constantly needing others for, validation is very draining and exhausting.
Yeah. They have a very brittle ego, very brittle, very fragile.
Yeah. I could talk to you for hours, honestly, and I find everything that you speak about so interesting, and I think a lot of people today watching are probably going to be really interested in where they can, access some of your materials. So can you please tell us regarding your book, where can someone purchase it? And I know you have a course, right?
Yeah.
And you have
you can find me through TikTok, Instagram, YouTube, all of it. Kerry McAvoy, PhD, just one big, smash those words together. Kerry McAvoy, PhD. Like I said, I have a book called Love You More: The Harrowing Tale of Lies, Sex Addiction, and Double Cross. It's sold wherever books are sold online. And then there's that course coming out November 1st called First Steps to Leaving a Narcissist. Has a workbook component that will be sold again online or wherever you find books like that. But you can find this course again there's a link in my bio on Instagram. So if you click on the link, you'll find a page that takes you to all the stuff that I'm currently doing and what I'm up to. And finally, I have a podcast called Breaking Free from Narcissistic Abuse. And it has new episodes every Monday and Thursday. Again, it's discussing these types of topics, and I'm on wherever you find podcasts.
And it's not just narcissistic abuse. Don't pigeonhole yourself, because I've seen you talk about so many other topics.
I do. I do. But even what good life is like or a good relationship. But yeah,
Yeah.
most people, though, are more interested about abuse just because there's more people than you think. Sandra Brown estimates just with the psychopathic abuse and whatnot, there's
Yeah.
60 to 100 million people in the United States alone who are infected by this. That it's costing us in mental health care costs and medical costs
Yeah.
$560 billion a year. So
Wow. Yeah.
it's awful.
Yeah. I think, I don't know if I don't know, like we should start like a nationwide campaign where we start educating
Yeah.
not, children at a young age and people in high school what to look for and what to avoid, and but also kind of really teaching parents is, don't do this to your child, and I mean, certain things, if you need the help, get the help.
Yeah.
Don't put your child through something like that just because
Yeah.
hope. And you said like the mental health aspects, but the physical that we've seen. I before we close, I just kind of wanted to recommend, if you haven't seen it, the documentary Heal, which yeah, really amazing. I think I think you can find it on YouTube or Amazon Prime. It kind of chronicles these people who were diagnosed with end stage malignancies, and how as part of their healing process, they did the physical, right, and the medical aspect. But then there was so many that had these inner wounds and inner trauma that they really kind of almost had to catharsis, kind of just to heal. And it's a documentary, and the end of the documentary, you see how like successful a lot of the cases were in people who had like stage 4 cancer, and so very, very, very interesting.
That sounds fascinating. I'll definitely check it out. One
Yeah.
other thing I want to make sure to say, I forgot to say, is that I'm interviewing Sandra Brown on November 10th. It's
Okay.
called "How Could I Fallen for a Dangerous Man?" And we're going to be talking about the traits that that make people vulnerable
Yeah.
to dangerous people. So
Mm,
if you'd like to learn more about the victimology, what actually, is it really codependent? What did she find? She was looking, that was her question.
yeah.
What makes people vulnerable to falling into these relationships? If you'd like to learn more about what happens and how to reduce your vulnerability, be sure to check out that. Again, it's November 10th. How could I fallen for a dangerous man? And if you can't make it, ticket holders will get a free replay.
Are you going to be doing it on Instagram or on your podcast?
It's going to be actually a live webinar, so you have to register. It's 90 minutes interview that the audience will get to witness, and then ask your questions at the last 30 minutes. So there'll be audience participation at the end.
Okay, everyone on here, follow her. She's amazing.
Thank you. I appreciate that. Appreciate that.
Take care.
Yeah, you too. Bye bye.